a cartoon of this, but you're going to have a zone of vaporization where the laser beam hits the skin, a zone right outside of that of necrosis and cauterization. This presentation makes a differentiation between a higher wattage with a short duration that vaporizes versus a lower wattage and a longer pulse width that causes more of a coagulation zone. To me, these are rather academic. They are real, but they're academic, and I'll share with you a little bit about how I approach the face as far as energy levels go a little bit later. But suffice it to say that we're looking for everything. We love vaporization. We love coagulation. The necrosis is not bad, and we do get tissue contraction when we do aggressive treatments. Again, you can see the energy is absorbed. Once you reach a certain amount, the tissue is actually vaporized. There's always a zone of coagulation right outside of that. And that zone of coagulation is critical because of how it works. And we really don't understand. So this is kind of looking through a cut through like a donut. We're looking at a zone of vaporization. Yeah, just a little. You really can't use fractional CO2 without being able to talk to patients during a consult about what the technology is and how it's different from traditional technology. So some of you guys are very knowledgeable about CO2 lasers that came on. They were wonderful. You could cut with them. You could resurface with them. I'll show you the schematic in a minute that kind of shows what a non-fractional treatment looked like. The old CO2 lasers had a scanner just like the ones we have now, except when they scan, they hit all the tissue with basically these overlapping donuts. So this is kind of important from the standpoint of you as a clinician kind of understanding what's happening with the energy. When we went from super pulse to ultra pulse, what we were able to do is basically allow energy to go into the tissue in a pulse way. And what that did from a standpoint of cutting is it caused there to be less peripheral damage to the tissue. So whatever tissue you vaporize. There's a very, very thin level of coagulant. And I've got a train going by. I'm in a very picturesque environment in Germantown, right outside of Memphis, Tennessee. And I guess the physician that first built his building in 1886, where we locate our medical practice, built it right next to the train station. And so it's a wonderful medical office for us, but we have to put up with the train every once in a while coming by. So if y'all can message me if that train gets so loud that you can't hear anything. Anyway, so back to the ultra pulse and the super pulse. So the difference historically between going from a super pulse, which was, I don't understand all the electronic technology behind the beam of the generation of the beam, but used to the technology didn't allow us to turn off and on immediately like ultra pulse did. And so the ultra pulse was an advantage in that it allowed for cutting technologies for us to be able to have as minimal of a zone of coagulation as possible from using it to cut, like when you're doing a blepharoplasty. And you could do that with your Mixto. You could get a cutting handpiece with it, and it's really, really wonderful. But what I want to tell you is that the value of, and I'm not going to really name any other brands out there, but the value of having a continuous way of energy for doing fractional resurfacing at the face is really great from a marketing standpoint. I'm going to show you some of my photos in a few minutes of a patient, 1 day post-treatment, 4 days, 5 days, 7 days, 9 days. And what you'll appreciate is although they look a little bit worked over, they don't have that look that patients had that were treated with ultra pulse or super pulse resurfacing technology. Those technologies have no coagulation, and because of that, they really have blood running down their face, and they just really they don't present very well to their family members or to themselves, and it just is, from a marketing standpoint, it's really difficult. I don't think you really get any advantage. You get a little bit of extra depth with that, but I'll reassure you that I have no trouble with continuous wave technology being able to get to the depth that I want to get. Here's a good cut through of skin, kind of let you know the depth. These are not to scale, but you can see using some different energy technologies, Irving had, and using CO2, what kind of different depths you can get. I guess the main point is, I'm not sure how well this demonstrates it, but superpulse technology can go a little bit deeper. There's less of a zone of coagulation, and these patients bleed because these capillaries that you get. It's all good. Again, here's it's really fun to kind of start playing with your laser and doing some different things. I'll give you some starting tips, and just within several weeks of having your laser, you can be doing pretty amazing work. Again, this kind of points out some differences between ultrapulse, superpulse, and continuous wave technology, and how well they do relative to thermal damage, ablation, and skin tightening. I agree with this. I think continuous wave is better. This just points out why you want the heat, because it causes contracture, it causes a coagulum, that serves as sort of a temporary bandage while new tissue grows in. It's really nice to have a dry surgical field that you're working with when you're doing resurfacing. Decreased risk of infection, maybe, but it's the only way I would do it. So there's several references out there that agree that this is a better way to apply energy to the face. In my experience, we get results that nobody else in our geographic region has ever even gotten close to. And we've been performing a fractional CO2 therapy for about 3 years, and we've been using Mixto technology for close to 2 years. And as I'm talking about here, I am going to glance down and see if anybody's asking any questions. There's a question about patients who are internet experts. Wow, I embrace the internet. At the end of the day, patients do come in with ignorance, but I think they come in with less ignorance after they've read the internet. It's so great for them to come in with a working vocabulary, and those consults for me are actually a lot faster, even if I have to reteach a patient what the truth is. And basically, you can tell the truth with photos, and we're able to go through photos and do a consultation and have patients really quickly knowing that they don't want to go anywhere else for their technology, for their treatment. And I think we charge a lot more than anybody else does for fractional CO2 treatments on the face, because we deliver a result that's a whole lot better. So here's a great visual. Traditional resurfacing CO2 actually overlaps. The laser beams overlap. You can see with fractional technology they don't, and you get this skip around, which causes heat not to build up too much in any one area, dissipate, and when the beam comes back around to the neighborhood, you're not stacking heat on top of heat. So it allows you to be more exact in your treatment. Listen, you can do another pass, you can turn the watts up to 30 watts, you can deliver as much energy as you want to, but when the scanner skips around, it allows you to do a more smooth, even treatment, and it makes it more predictable.
Dr. Laurence, let me pull up the video real quick and